Are we live? Unique New York. There it is, Unique New York. This was Dr. E's choice. Ice Ice Baby. We're letting it rock. We're not going to get sued because we're talking over it.
Right, it's just in the background.
Yeah. All right, we are joined by Dr. E. Welcome to Bono's Health. I believe this is episode 113. I gotta do better at knowing what's going on there. He's a prolific podcaster. I saw you had the Untold Physio stories going all the way back to 2016.
Oh yeah, and before that, I think probably in 2010,
you had a different one,
2013, something like that. We were the first major PT podcast. Gosh, Therapy Insiders. I can't remember the name. Yeah, one of the old school traditional like long form interview podcasts.
Yeah, and you're going strong. They're going strong. They shifted in 2016. So if anyone wants to check it out, we just recorded an episode. So look out. Hopefully the audio came out all right on that one. I'm gonna cut Vanilla Ice there. Sorry, Vanilla. I forgot what his real name is. I probably knew that at some point. Fun trivia fact. Do you know what?
I forget it too. I know he owns a surf shop now.
Oh, that's fun.
Yeah.
Anyway, did he do one of those like 90s boxer things like celebrities boxing with like Tanya Harding or
right.
One of those?
Oh man, yeah. I think he fought Tanya Harding. It was pretty interesting.
I hope that's not true.
He went for the knee.
Boo. All right, so Dr. E is all the way in Buffalo, New York. There's no 6 feet of snow yet. Not yet.
No. I mean, if you've ever taken my live or online course, that's the picture I show of me during one of our major snowstorms that shut down the city for like over a week. Luckily, we had just gone grocery shopping. We were stocked up on beer and wine. But there's a picture of me like just in the middle of a whiteout blizzard with a measuring tape measuring 6 feet of snow over my mailbox. I had at the time I had a Ford Edge, not a Ford Edge, the Ford Flex, which is like a big boxy wagon thing. I couldn't see it. I basically walked over it to get to the end of my driveway. Yeah, it was nuts. Yeah, that's not every year though. Yeah, that's what we're known for, but that's not every year.
Anyone who loves snow, head up to Buffalo.
Nice.
Yeah. We're not going to mention Bills Mafia because Dr. E does not like football. So hold that against him if you like, or applaud him.
I don't have anything against it. I just don't follow football. I don't say I hate football. I just don't follow football.
And, we'll give you a little slack since you have 6 children. Not a lot of time for much else. And you're also one of the most prolific, I would say, figures in the physical therapy space. I've heard of you for again, a long time. Definitely one of the celebrities in the space if we want to go there. So, yeah, many different things, teaching. Are you currently still seeing folks one-on-one at all?
Yeah, absolutely. Yeah. In fact, I just walked out of my clinic with crappy internet. I'm sitting here in the parking lot where the internet happens to be better. So yeah, I have a cash-based PT practice, Rehab and Sport Science. Everything is e-based, right? Always be selling. And so yeah, I see people, like a handful every week. Mostly like you, the people who have tried everything except for good care, apparently.
Yeah. Well, that's the thing, right? Is the system is designed the way it is, and it does good enough, I guess, and most people are okay with that status quo, and versus understanding that there's options to be optimal, to thrive, not just survive and get out of some pain and walk away being like, yeah, it feels a little better. So yeah, it's a huge difference in what we're talking about here for anyone who's listened to my podcast. If this is your first episode, it's something I preach every single episode, including my other podcast, the Demand Better podcast, where we're calling out the professions. And in fact, I have recording my next episode with Brooke Seam, a friend of mine, old CrossFit teammate, and she's demanding better from the psychiatric profession because she was put on antidepressants at 15, and she tells the story. She just published her book, and not to plug her book too much here, but at the same time, it's 15 years of being in the system. She does a really good job for anyone who wants to see how you just get go from one psychiatrist to a psychologist and get put on pills, and they're just like, yeah, get out of my office, basically. Like, she tells the story very, very colorfully, and there's a lot of unique stuff there. But yeah, it's unfortunately, I'm sure you've covered it a lot on your Untold Physio Stories podcast of the frustration of this system that we're in. And
Yeah.
so,
I mean,
mhm,
that's a soapbox I could definitely go on too. I mean, there is just the system is the system, whether it's meds, but I mean, I would say PTs, chiros, massage therapists, rehab professionals, we could be part of that system too. If you literally just take people's money and never have any change, you
mhm,
know, if you have every clinic, I always say has their lifers, but if the majority of your patients are lifers, then you're doing something wrong because ultimately,
yeah,
unless you do have like, a lot of fitness and wellness built into your program, if you're doing, traditional kind of PT, my whole thing is better and force, see me no more. Because you're either gonna be better or it's not gonna work.
mhm.
But I'm not gonna just keep on taking your money if we're getting no change.
Right. Right. And that's the
Yeah.
frustrating thing. I found it to be when I lived in Southern California to be just all too common, much less common when I was in New York City, because I think it's a little bit of mindset shift, if you will, but without going into offending too many people in that regard. But when I was in Southern California, so many folks, when I would ask them about their back pain or have those conversations, like, well, I've been going to see my chiropractor for the last 10 years, and I just go see him anytime my back hurts, and he pops it back in place or readjusts me, and it's like that's the system. And it's in my mind I'm screaming like, don't you want to get out of the pain? Can we do something? So yeah, that's my business. I talk about, let's I can help you feel better and move better in 30 minutes, but we got to put a plan in place for the next 30 days. And if we're not measuring outcomes, and if you're not holding me accountable, I'm charging you X amount of dollars because I want you to make a change. And that's the other way that I talk about it with folks. I'll just throw out a random client I kind of have right now, who I met through a CrossFit space, and she's dealing with some hip stuff, and she's a personal trainer herself. And I just had this conversation with her. She's considering going through insurance, and I'm like, you might get better. She's been dealing with it now. She stopped seeing me for a little while. She tried to go the insurance route, and now she's worse than she ever was. And I'm looking at her. I'm like, hey, for the next 12 weeks, I'm going to put you on this particular plan. I'm here for you, and that's going to cost you $2,000 based on how many times we see each other in person and the online support. And that's a tricky thing to say, and I can't guarantee with $2,000 that you're going to be better. But that's kind of the long and short of it. I don't know if we're going to ever see a system like that. There was recently this what's the act, you're probably familiar, the no surprises act that's kind of been
Oh yeah, the No
required.
Surprises Act.
No
Yeah,
surprise
the
act.
no surprise. I mean, I would say as a consumer who's been burned so many times anyway, you think like even if they're in network, you go to your doctor, your surgeon's in network, but like every single person they use, every single blood work every single test that's run on you, it's all run by out of network people, and you still end up with a huge bill. I would say as a consumer, I like the No Surprises Act. As a clinician who's out of network,
Hmm,
it's terrible, and
hmm,
I understand why the public needs to be protected, but I mean, you just can't say like, oh yeah, I'm definitely gonna it's definitely going to be this much because I don't know. It could be simple. It could be complex.
yeah.
I think it might be easier for someone like you who has like a flat rate, but me who's just charging, top dollar per visit. All I can do is just average per visit. Like, well, oh, you have low back pain. Chances are it's going to take 4 to 6 visits. You have whatever post op might take 8 to 10 visits, even though I don't see a lot of post ops. I mean, the majority of my patients, very rarely is it acute, and it's only acute if I happen to see someone who I've seen in the past, and they know I can get them better quickly. But most of the people have been through the system, and regardless of how long they've had pain, I still get the majority of them better in 4 to 6 visits. But it's really hard to say that it's going to be the fair estimate, whatever.
Hmm.
It is what it is. I mean, again, I think I understand the need for it, so people don't get burned, but it ends up burning people like you and I way more than like the actual system that is all in network that don't have to provide their patient with a fair estimate. It's
Right.
only people who are like trying to do better, trying to provide like a concierge level of care, and trying not to overutilize. Essentially, it doesn't protect the consumer at all from
Hmm.
overutilization of your typical healthcare.
Yeah. Yeah, it's frustrating. My wife's a sex and relationship therapist. So if a couple's coming to her like, hey, we're having marital problems because of XYZ, and she's like, well, we can solve this in 3 sessions. We can solve this in 100 sessions. It's like, do you give a range of like, it can take anywhere, you said 4 to 6
I
for low
know.
back pain. That's like almost some, and yeah, that's fair. Versus, and I think at the end of the day, the thing I always picked up back from physical therapy school is defensible documentation. So yeah, if that's the law and you just have to say, kind of cover your butt, cover your ass, of saying like, I did my best to give an estimate and say, hey, again, I have this 12-week program that, it might not even fall under physical therapy technically, but it's going to strengthen this, and we can get into whether it's coaching or this. There are all these kind of gray areas where no one, I certainly don't want to sound like I'm trying to skirt the system, but the system again it's pretty shitty. And so, I, like you said, and alluded to, we want to protect the consumer. And at the end of the day, I think we've gone into this educational system. We're trying to work with other clinicians to make sure that the system is improving, that we're helping consumers on some level, and hopefully moving them away from again, that kind of eat them up, spit them out system that just keeps folks not getting better. And for us to trying to do better and then have to fall within this kind of compliance it's a little frustrating to say the least. But yeah.
Yeah, I mean, well, I think last time I talked to Aaron LeBauer about it, he said that, even though you have to provide a fair estimate, I don't know if you know who Gwen Simons is. She's a PT and a manual therapy fellow, but she's also a lawyer, so she does a lot of PT legal stuff. Do you know who she is?
I've not heard the name, no.
Okay, well, in her big webinar that she held for a lot of PTs, because she, again, can interpret these things a lot better than we can. Her stance, according to Aaron, was that you really only need to provide the fair estimate if someone asks you for the fair estimate, or they definitely tell you, hey, I'm going to submit for out of network. Um,
Mm-hmm.
so if they're not even submitting for out of network, you don't have to provide a fair estimate because they're just willing to pay whatever it is you have. But if they say, hey, you know what, I'm definitely submitting for out of network, then you have to give them that fair estimate.
Right. Yeah. And again, the law is just kind of, it's going to be hard with a lot of things for folks to come after you. As if you have a license, a physical therapy license, it does have some restrictions. And again, sometimes it's like I'd rather be a coach and put things under my fitness side rather than the physical therapy side, because it is a little bit less litigious, less issues there. But even on the physical therapy side, again, that's one of the reasons our malpractice insurance is so low, because again, for us to really do harm, it's going to take a lot. I only
It
got
is.
into
It's mostly burns, right? That's like
burns
the
and
thing that.
well, since moving here, and I know you're in New York State where I did practice for a long time, dry needling, where again, a little crazy that physical therapists are not allowed in a couple of states to put needles in folks. But the one big thing there is possibly puncturing a lung, which I have heard of a
It
few
is, but it's
folks.
still rare.
Still
That's the
pretty
thing.
rare
It's
for
still
sure.
rare. Even when it
Hmm.
happens, it's been documented, and just like a adverse event, VBI, or stroke or something after thrust manipulation. Um, it happens. It happens more times when a chiro does it rather than a PT. Um, and in fact, actually, soapbox. One of my friends on social media was like, "Hey, is this you in this video?" And it just so happened that I couldn't click on this video. When I finally saw this video, it's this guy, like, surgeon reacts, orthopedic surgeon reacts, and he's like,
Mm.
whatever. I hate these stupid reaction videos. Like, you have to be like such an egotistical maniac to think that how you react to something else is worth watching. But anyway, people like watching reaction videos. This guy has more followers than me.
Hmm.
Just last week, a chiropractor apparently, almost killed a 20-something-year-old. She had a stroke. I didn't really look into the case, but as part of his reacts video, he uses footage from one of my seminars from my
Wow.
YouTube channel without permission,
Mm.
talking about how dangerous it is for chiropractors to do thrust manipulation. Look at this. This is a room full of chiropractors learning how to manipulate. It's so dangerous. Whatever, whatever, whatever. Meanwhile, I'm a PT teaching a bunch of PTs. That doesn't make it. I don't want to argue with him,
Right.
you know.
Right. Yeah. That's
But
never going to lead to a victory.
no, absolutely not. He already has his mind made up, and it would probably be even worse for him to find out that he actually used PTs. I just flagged the video for defamation and
Yeah.
copyright infringement because he didn't ask me for
Yeah.
permission to use my video anyway.
Yeah, I mean, hopefully there are situations like that where maybe we can reach out to the person, and you see how they respond, and it might not be worth your time, but that would be my instinct, again, in this kind of crazy climate we're living in, where people are so quick to respond and so extreme. And might be nice to see if you can, reach across that aisle and and maybe
Right. Well,
get
yeah.
some understanding.
Immediately I went on. Yeah. Immediately I went on the defensive, but that is good advice because maybe he's a super nice guy who just likes to make reaction videos.
Yeah, I mean, in the PT space, I'm sure you know Adam Meekins over in the UK, and he'll do a lot of videos where he's very controversial, and I think he'll admit, whatever, maybe 1 out of 10 times, someone actually reaches out and is like, hey, like he blocked me for some reason at some point on Twitter or Instagram or something. And I'm like, what? Like, and I reached out to him and I was like, hey, like, what happened there? Like, I'm actually a fan of most of the stuff you post. Like, I might have, again, like through some criticism. And again, I think because of the type of person he portrays himself as, he's gonna have a little bit of a short temper and like, oh, you don't agree with me, like boom, banned. And like he's always posting that stuff. And at the end of the day, too, when we talk about the grand scheme of all this stuff in the I do want to come back to the cervical manipulation piece. I think there's a lot of interesting stuff there, but I do think it's interesting all these physical therapists arguing with each other about pain science, about oh, you're still doing manual therapy, like that's terrible, and
Oh
like
man.
you
The
know
anti-manual therapy sentiment is like the worst. And I get it. I get it totally. Because when a patient's like, can't you just adjust it? Can't you fix it? Can't you whatever? Can't you just needle it? Can't you poke it? Whatever they had positive experience with before in the past. One of my Jedi mind tricks is, do you have a problem with activity? Yeah, of course I have a problem with activity. That's why I'm seeing you. Well, then you need an active solution, right?
yes,
So that's one of my things that I like to make them think like, yeah, go ahead and get your adjustment over and over and over again. But another Jedi mind trick number two would be, you getting an adjustment, the massage, whatever it is, ISTM, anything, mobilization, you getting a passive technique like that and expecting to get better is like you going to a personal trainer or strength coach to them lifting for you and you expecting to get fit. Like at some point, is it the system or is it you?
right,
In
right.
a way, it's the system for not giving you accountability. Accountability is, I
Hmm.
think, the thing that you and I probably strive for the most. Our programs may even look different, but I mean, overall, it's the program
Hmm.
that makes a difference. So I'm not against manual therapy. I'm just against using manual therapy as a fix.
Right.
You say you're fixing someone, that's what's wrong.
Yeah.
But if
Yeah.
you can't be against manual therapy, if you have the means to actually make someone's exercise for tendinopathy be pain free versus just saying, oh, research shows it's okay to
Hmm.
exercise into pain. Yeah, but I mean, if it's all about dosage and intensity, I think you're just being a jerk
Hmm.
if you have the means to modulate pain and you don't. Like I've even heard someone say, "Oh, Adam Meekins is against manual therapy," but yeah, he also has super high volume socialist medicine practice where he wouldn't even have time to do manual therapy, and that's why he doesn't
Right.
do manual therapy. Regardless of the reasons, you can't be against it. Like you want to do craniosacral therapy, that's fine. I don't like craniosacral therapy. I'm not going to tell you you shouldn't be doing it. You might, I might say you shouldn't be explaining that it's doing what you think it's doing, but if it's
Right.
helping a patient, that's fine. Are you giving them any active strategies to actually keep up with any of the gains you made in your clinic? That's more my concern.
Right. Yeah, and again, the other part I'll throw in on top of that is when folks cite evidence-based practice, and it's like, well, does the evidence really say that? And Adam Meekins is an interesting example of, for anyone following him, he'll be like, here's what this one study shows. And sometimes, and it's like, well, is that the whole story? First of all, is there cherry picking? And at the same time, coming back to the cervical manipulation piece, just to come back to the evidence of it, evidence research is hard. Let's acknowledge that. I think most research is flawed, significantly flawed, and it's gonna take a long time. And so, if there is anything in research where it says like doing a cervical manipulation will improve, and like we can really strongly say it's going to improve your outcomes by 72% or whatever. There's very, very, very few things where, again, you can get a room of 100 physical therapists picked from random places, and and they're going to agree on any one thing. And that's kind of what I always say about, when people ask me about going to do surgery and things like that. I say, you can go to X amount of surgeons and you're going to get X amount of opinions, if not X plus 10 amount of opinions, because everyone's going to have multiple opinions. So coming back to the cervical manipulation, like what the research, my understanding is, and I think you kind of alluded to it as well, is for cervical manipulation, I believe it causes stroke or a dissection of the artery there, the arterial, the aortic, no, yeah, aortic artery,
Vertebral artery. Yeah.
vertebral artery. Yes, that's what I meant. Aortic. Yeah, that wouldn't make sense.
I hope it does. You'd have to be manipulating someone
That would
pretty
be
hard.
good. That would be good. Sorry, the
Yeah.
vertebral artery, and I believe the occurrence that I've seen in the research is 1 out of every like 4 million cervical manipulations, something like that. You
Yeah,
know,
it's like there's several studies that I usually cite in my manip class. Could be 1 in 1 million, up to 1 in 10 million. I've heard it much lower than that, but I mean, the other thing with that is it doesn't take into account of all the like just times the layperson just self manipulates. Or someone also said something like, when I was in my manual therapy training like 24 years ago, a buddy in my class was like, "Oh, who manipulates the most?" And I'll ask this question to you: Who do you think manipulates the cervical spine the most?
chiropractors.
Yeah, our answer is always going to be like chiros or osteopaths or PTs or whatever. He just said it's Chinese barbers, and I don't know if this is like this joke of a stat or whatever,
Yeah.
but what it is like if everyone gets a manipulation because they're all lay bone setters,
Mm,
you
mm.
know, and they don't like take into account all these manipulations that are just happening like
Right.
every day. It's not even healthcare.
Right. Right.
If it was
And
really like a deadly thing, as this orthopedic surgeon reacts would say, then there'd be more trouble. But you know, when I was actually going to reply, and I actually typed out a reply, um, a sensible reply was that, you know, if you really looked at the research, you would see one, I'm a PT and not a
yeah.
chiropractor, and two, research shows, and I alluded to earlier, 70, like up to 75% of the time when an adverse event happens, it's usually at the hands of a chiro, and it's like less than 10% of the time it's at the hands of a PT. Does that mean we're doing less manipulations? Probably that's what we're doing, but there's also less adverse events. But also, the iatrogenic either like death or stroke or anything is significantly higher after you see an MD.
Hmm.
And a couple of chiropractors who've taken my courses have said that before too. Like they chiropractors in their defense have done a lot of research, and of course, because MDs are prescribing meds or whatever, maybe the people who see them in general are less healthy, but the stats are way higher for iatrogenic adverse events when you see an
Hmm.
MD versus a PT or a chiro. And apparently, this orthopedic surgeon reacts doesn't realize that.
Yeah. Yeah. And again, to that point, back to the research thing in my mind is research is flawed, and there's just correlation causation. Is a huge piece of that that folks
Right.
need to understand. Again, even if we find a relationship and say, again, yeah, it seems that more chiropractors are causing this kind of thing. Like, what else is going on? Are those patients? Are they seeing more of the type of patient that is problematic? Again, not to go into the C word, the COVID thing, but there was definitely
Right.
a lot of saying, yeah, a lot of the folks that passed away were very unhealthy. The more unhealthy you were, the more comorbidities you had, the more likely you were to pass away. So,
For sure.
yeah, and again, it's very difficult on this global scale to look at some of that stuff. But even back for me, the thing I think of with cervical manipulations, not to keep kind of punching that one in the mouth, is even if it's 4 million, let's throw that number out there. If I can throw a stone and hit 10 chiropractic clinics from where I live, and a lot of those models, not every chiropractor is like this by any means, but if they're seeing 30 patients a day, and they're doing a cervical manipulation on almost all of them, you start doing the math on that, and you're like, there's probably 4 million cervical manipulations happening per day. So there's at least one person dying of a stroke per
At
day.
least.
Like, and so,
Yeah,
and the numbers are, yeah, and the numbers are most likely underreported in a lot of
right.
ways. But
Or were they going to have a stroke anyway? You know, that's the thing.
yes, that's the
Is it
part. Yeah.
underreported? Yeah, I would say maybe the strokes are underreported because it doesn't always happen on the table, right? But
Hmm.
the other thing is that there's just a lot of there's probably a lot. The amount of cervical manipulations are also underreported.
Yeah. Yeah.
You know,
Yeah.
in my courses, I call it winning the bad lottery, and I just say I just leave it up to you, and I always give informed consent because professionally, I always say that I would rather talk someone out of a manipulation rather than talk
Hmm.
someone into it. And I have given informed consent with those statistics we've been talking about, and people have said, "Look, if you kill me, I'm not going to come back and haunt you." And I've had other people say, "I didn't know these risks. I no longer want manipulations from you, and I'm going to tell my chiropractor the same thing." And that's it, you know. But all the testing we have, like vertebral artery test and like alar ligaments and all these things we learn in school for upper cervical instability. Turns out you can't predict it.
No.
There are risk factors. You know, if someone has like high blood pressure, if someone like has multiple comorbidities, if they kind of reek of smoke and they're just generally unwell, multiple comorbidities, I don't ever consider cervical thrust manipulation.
Yeah.
But if someone's a young, healthy individual, chances are it's not going to happen. We just can't
Right.
predict it.
Yeah, the other evidence piece for me, and one of the reasons I almost never do cervical manipulations is the outcomes seem to be not phenomenal. I'm sure there are. Again, you can go through the clinical prediction rules and the evidence in motion team. Those folks have done a lot of good research on that. But for me, it's just even if that risk is 1 in 4 million, and I feel really confident in being able to do a cervical manipulation, I still don't think it changes the outcomes that much. We talk about an active solution, which I love that kind of concept. And then again, the other piece for me that I see is thoracic manipulation seems to have just as much beneficial outcomes and much safer in theory at that regard. So yeah, the research is just kind of it's there. I think we need to acknowledge it, but again, it's still limited in a lot of ways. But that's my take on the research. I don't know if you're teaching something different, so I don't want to step on your course's toes.
No, absolutely. I mean, I just say in general, whether it's cervical manipulation, mobilization, soft tissue work, mulligan snag, whatever it is, manual therapy has a transient effect. And in fact, the more rapid the effect is of the relief, the more rapid it tends to go away.
Hmm.
So, for me, I just use like Greg Lehman's analogy now of the recovery as a cup, and manipulation, exercise, whatever, anything I do in the clinic, whatever treatment I choose, is going to empty your cup a little bit. So recovery and getting out of pain is all about building a bigger cup, nutritional strengthening and everything, but also avoiding, and I think a lot of clinicians miss this, avoiding things that fill up the cup, right? Get better sleep, eat better food, change positions more often. It's not good posture and bad posture. There's no good posture and bad posture anymore than there are good exercises and bad exercises. There's just too much of one thing and not enough of another. There's not enough variability throughout your day. Do you have any maladaptive beliefs, like you think that you need a manipulation because you have a vertebral subluxation complex, and if you don't get this adjusted every once in a while, you're going to be paralyzed or dead, which is what some chiropractors in the area have told people. They have a running video that's like a subluxation leads to this, leads to this, leads to this, leads to death. I'm like, well, this guy has the answer to death. If you just get adjusted every once in a while, you're going to live forever. This guy's been around for thousands of years. So yeah, I don't care about the treatment. I care about, and we've talked about this before, I care about the plan. Um,
Hmm.
the one thing about the clinical prediction rule for cervical thrust manipulation, which is why I would choose it, and even though I teach this for a living, I still don't do it even more than like once or twice a month. It's one of the major things that they studied in the pilot study for clinical prediction rules is that if a patient has a positive expectation that they're going to benefit from it, like if they want it,
Hmm. Hmm.
I provide it, but I still tell them,
Yep.
hey, you know what? You still have to do like this end range loading reset. That my program is really big on end range loading resets because that will have the same effect. If you
Hmm.
do this repeatedly 10 times an hour, do all the other things I gave you in your recovery plan, you're not going to need me or anyone else to do this. So
Yep.
I'll take your money, or you can give your money to another clinician forever, or you can just be like one of the 80% that responds rapidly and follow the program and not need me or anyone else unless like you overdo it again.
Yeah, and that's kind of my model as well. Is we talk about, I think a lot of clinicians talk about empowering the patient and all that good stuff, and there's just this huge gap in what that really means. And for me, that means, hey, let's get in a 6 month plan where at the end of the 6 months, I think you as my client will know more than 99% of medical providers of what you need, because I'm going to have that conversation with you and we're going to try stuff. We're going to see what works. And the more empowered you are, not just doing self myofascial release, which is one of the reasons I think Kelly Starrett did blow up in the CrossFit space. Active people saying, "Hey, I can and watch these 10-minute videos," which at the time was like unheard of. Again, even then it was like if you're more than 30 seconds, it's no one's gonna watch that. But he was talking and people were listening. He was giving out this awesome free information. He was one of the first PTs to really do this on a global scale, I would say. So for anyone who hasn't checked him out, I've had him him and his wife on my podcast on episode, I believe. Oh man, I should get better at knowing my episodes. A few episodes ago.
I
But
don't
that was a
know. I don't know my episode numbers and who was on them. So
yeah, yeah.
if you do, that's
Um,
great.
I'm only at like 113, so I mean, I feel like I should. I don't have a huge, you have thousands of episodes, I think, right? So give
No,
you a
I
little more.
don't. I'm only on episode 248
Really?
or something like that.
But you
Yeah.
slacking, man. You've been just the
Well,
switch to
that's
Untitled.
because I'm like putting all my time and money into Instagram Reels and YouTube Shorts and whatever else, and I still like post blog posts. Like I just try to hit people wherever they could find me.
Yeah. 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 So the whole point is, again, I think that at the end of the day, this model, we have some folks, hopefully two of us here, trying to elevate this profession and trying to get consumers to have better outcomes. And I think at the end of the day, that's what it's going to take, is how do we get to the consumer? And in my experience, when I work with business coaches and they ask me, like, who do you want to niche down on, or, who do you want to work with? And I say, well, I noticed that I do the best and I get the most buy-in with people who have failed with 10 other clinicians. Like, I'd love to get to them before they go through that and they fail with 10 other clinicians. Maybe they need that to work with me. I don't think they need it, but it might for some folks take that convincing and frustration for them to say, hey, I'm ready to give you $6,000, for the next year. And we're going to talk about nutrition. And at the end of the day, cost is what you pay, value is what you get. I'm pretty confident. I very much stand behind the value I'm bringing. And I think the value is probably undervalued in terms of what I'm actually charging, but it still has to match the market and all that stuff. But it's just a very radical approach that I, not to keep talking about my own business, but I do think there's that missing component. And again, for a lot of people, to the general public, it is very difficult to overcome naked bodies, sexy abs, the stories of, I'm going to get you better. And you walk in here with neck pain, I crack your neck, and you walk out of here without neck pain. Like, that's a pretty powerful thing. Not wanting to have the conversation of, how do I make this stop coming back? And folks are just happy. Again, I've been going to Dr. So-and-so for 10 years. And every time I have neck pain, it's been getting worse for 10 years, but that's part of aging. And it's like, well, it doesn't have
It's
to
part
be
of
so.
aging, right?
Yeah.
That's why I love that gray hairs on the inside analogy.
Yeah, that's a good one. Yeah. And also, like, degenerative disc disease is not, we're not supposed to use that term degenerative because it's a normal part of aging. Your discs are supposed to degenerate. So it's like saying, hey, your diagnosis is you have wrinkles on your face. Like, it's a normal part of aging, and it is a sign of some.
My dad eyes are, look, I have moderate to severe degeneration all around my eyes. Oh my gosh. It hurts so bad.
Yeah. And not to take anyone's degenerative disc disease pain down, but yeah, obviously there's other things going on.
That fills up the cup. That is just something that fills up the cup. It is not the cup.
Right. And it's incredible, again, how we as a profession ignore nutrition, stress, the cup concept. It's really amazing. And I've talked to physical therapy clinics and said, hey, I can offer nutritional coaching for your patient going through an ACL rehab. And there's definitely a scarcity mindset out there. And it's an unproven thing. And it's just so out of the norm. Like, you think they're going to pay you to talk about nutrition? I can give them a little pamphlet and that'll change everything, right? No, like, that doesn't work. And you need that accountability. I think you alluded to it. I think it was on this one, not on our other recording, but accountability is absolutely what is missing. And again, right now, most clinicians, I think, are happy with good enough. And there's that extra 10, 20% of healing and optimizing and thriving that, we're missing, where professional athletes, I tell people this all the time, like, look, you're an athlete. You want to get better as fast as possible. Yeah, if you rest, or if you try this program, this, whatever, knees over toes guy online, like, not to pick on that, but like, you might get 70% of the way there, but like, that other 30% is pretty significant. And that might be the difference between what you're going to look like 30 years from now. So yeah, anyway, I think we're speaking the same thing. We're on our same soapboxes. So I don't know if you want to leave folks with any last thoughts on
the Soapbox podcast.
Yes, that should be its own. I'm sure that if that's not a thing already.
Yeah, I'm sure someone's already doing it. I don't know about in the physio space, but someone should do it. And all these podcasts with like-minded clinicians end up being the same soapbox anyway.
Yep. I feel like, that's where I was like, I'm getting down my own little rabbit hole, and I'm just like, oh, I gotta stop myself. So let folks know where they can find you, and anything else you want to leave us with.
All right. Well, I go by Dr. E online. You could always call me Dr. E. Call me by my first name, Erson. But I'm at Modern Manual Therapy on Facebook, Instagram, YouTube. I'm also on LinkedIn. Basically, I kind of repost the same content. So whatever social media platform you want to follow me on, you can follow me there. I have an e-commerce store. I sell BFR, manual therapy tools, all kinds of fitness and strength training products.
Did you get rid of the suspension trainer, the TRX one? Because I have one in my garage right now. I haven't seen
the Edge suspension trainer? No, I still have the Edge suspension trainer.
You still have it? Okay.
It's like the TRX Pro, but it's blue.
Yep.
And it costs less than the TRX Home. So, you know, I have that. Just go to edgemobilitysystem.com and I can give your listeners a coupon to save on that as a thanks for supporting small business. I appreciate that. So yeah, edgemobilitysystem.com is my store, and then Untold Physio Stories is my podcast. And I also have on Edge Mobility System, I have all my online courses if you are a PT or rehab clinician.
Awesome. Well, thank you again for your time, Dr. E. And we hope to hear more from you soon. If folks go check him out, reach out directly to him, tell him, have a reaction to his videos. So that's a good way to get a hold of him, I guess.
Right?
Post a reaction video.
I know. My video goes viral finally when it's actually being used for some nefarious purpose, not actually when I post it.
Yeah, that's how the internet works, folks.
That is how
all
it
right.
works. Yes, I live on in infamy.
There you go. All right. Hopefully not. Well, thank you again for being on here. And everyone out there, hopefully you got 1% better today. Let us know what you think. Leave some feedback. Share it with at least one person who you think will benefit. Leave a rating, review, like, subscribe, do whatever it's going to take to move and do. Anyway, love ya. Bye. Okay, 1%. Do the thing. We're ending.